delegates. We have Professor Asim Ali Khan, Director General CCRUM, as the guest of honor, and Professor M.H. Kazmi as Unani expert. Professor Asim Sahib was our eminent Unani expert to give a talk on E-Charcha. It is very encouraging to have Sir's presence as a guest of honor today. For our new viewers, I will again give a brief introduction of Sir. Sir is the Director General of Central Council for Research in Unani Medicine, Ministry of Ayush, a leading institution of scientific research into various fundamental and applied aspects of Unani medicine in the country. He is directing and coordinating various research programs through its 23 institutes spread across India. He is also the member of Board of Governors, Central Council of Indian Medicine, Government of India. He is involved and responsible for policy making, planning, implementation, and governance of quality education, training and researchers in Ayush system through all Ayush universities, all India institutes, national institutes, research institutes, government and private colleges. He is member on various important committees of Government of India. To name a few, an important one is member Niti Aayog Working Group Committee on Integration of Research, member Interdisciplinary Ayush R&D Task Force, member CSIR Ministry of Science and Technology Government of India, member Advisory Committee of CSIR TKDL, member Scientific Committee of PCIMNH Government of India. Sir has received more than 25 appreciations awards from various organizations as an appreciation for the services he rendered on various occasions. So I welcome you and I request you for the initial remarks for today's E-Charcha. Please, sir.
Assalamu alaikum and a very good afternoon to all of you. Thank you, Dr. Ghazala. Thank you so much for this brief introduction. Thank you, Team Ayush, who is into this process and who has initiated this dialogue of E-Charcha on Unani medicine and other systems of medicine also. Today we have a very eminent speaker from one of our institutions, Professor Munawwar Hussain Kazmi Sahib, the Director, National Research Institute of Unani Medicine for Skin Disorders, Hyderabad. Thank you, Dr. Munawwar, for being with us. And I also welcome our online participants from various research councils, peripheral institutions, universities, research institutions, colleges, and other participants who have joined us today for this E-Charcha. I am happy to deliver initial remarks for the third expert talk on the E-Charcha on Unani medicine for holistic health. It's conducted through the Ayush Virtual Convention Center platform today. In fact, this E-Charcha is streaming live on various social media platforms of Ministry of Ayush. The purpose is to make use of the potential of digital platforms to reach out to a larger audience. I am sure that this program is reaching to the masses widely. Today's talk on E-Charcha is on achievements of one of our premier institutions in the country, that is the National Research Institute of Unani Medicine for Skin Disorders, situated and located at Hyderabad, which is a specialty institute for skin disorders, and which is being delivered today by one of our eminent speaker and one of our institute directors, Professor Munawwar Hussain Kazmi, who is looking after and the charge and the responsibilities of this institution at Hyderabad. At present, the National Research Institute of Unani Medicine for Skin Disorders, it was formerly called as the Central Research Institute of Unani Medicine, Hyderabad, is a premier institute and is the most celebrated research institution of Unani system of medicine in the country. It has earned worldwide fame for the successful management of Barus, that is vitiligo, and other chronic and stubborn diseases, which include sinusitis, gastric and duodenal ulcers, hyperlipidemia, and psoriasis. This institution has also developed effective treatment for acute viral hepatitis. In Unani, we call it iltihab kabid had. The institute has also embarked upon developing standard operating procedures for manufacturing Unani formulations, besides taking the quality control aspect of drugs prepared in the institute's GMP certified pharmacy. The shelf life studies on Unani drugs have also been carried out since the year 2014 with a view to establish the expiry date of Unani system of medicine drugs. This institution in Hyderabad has been awarded the ISO certification as well. The pharmacy of the institution caters to the requirement of the research drugs and has been granted the Good Manufacturing Practices certification in 2004. Recently, institution hospital has also been accredited by NABH, and which is one of the first NABH institutions, hospitals in Unani system of medicine in the country, particularly of the CCRUM institutions. The institute has comprehensive facilities for teaching, research and patient care, and has a very good infrastructure comprising the academic blocks, administrative block, establishment and account sections, hospital building, pharmacy unit, drug quality testing laboratory, drug standardization research unit, reference library, survey and cultivation of medicinal plants unit, licensed animal house, guest house, hostels, residential block, statistics and medical record section, along with many other sections and units. The hospital has a state-of-the-art developed 85-bedded inpatient department and research OPDs, as well as the clinical services that are provided to the patients through various OPDs, including general OPD, specialty OPDs, and for skin diseases, non-communicable diseases, gastrointestinal disorders, and hepatobiliary disorders, neurological and psychiatric disorders, reproductive and child health care, and geriatric care. Dietary and nutritional advices are also provided to the patients with various disorders as per the Unani classics, along with modern perspective. I congratulate Dr. Munawar Hussain Kazmi Sahib, the director of the institution, and his team for making a mark and emerging as a specialty institute for skin disorders, and urge them to take this institute to new heights and to the new horizons. Friends, ये जो E-Charcha है, ये जो मिनिस्ट्री ऑफ आयुष ने इनिशिएटिव लिया है, एक बहुत अच्छा इनिशिएटिव है और हमें इसका भरपूर फायदा उठाना चाहिए। जो वर्चुअल कॉन्फ्रेंस सेंटर हमने बनाया है मिनिस्ट्री ऑफ आयुष ने, इसके जरिए से मुख्तलिफ प्रोग्राम्स हम वक्तन फवक्तन नशर करते रहते हैं और हमारी ख्वाहिश है और उम्मीद है कि ये एक बड़े मासेस तक पहुंचना चाहिए, न सिर्फ हमारे मुल्क में बल्कि गैर मुल्कों में जो लोग यूनानी सिस्टम ऑफ मेडिसिन को या आयुष सिस्टम ऑफ मेडिसिन को जानना चाहते हैं या उनको जानना चाहिए। मेरे ख्याल से एक अच्छा माध्यम है, एक अच्छा जरिया है उन तक पहुँचने के लिए। मुझे लगता है इसको जो लोग आज इसको देख रहे हैं उनसे मेरी रिक्वेस्ट है कि इसका पूरा प्रचार करें, इसको बाकी सब लोगों तक पहुंचाएं और इसका जितना ज़्यादा तशहीर कर सकते हैं वो अच्छा है, ताकि जो ज़रूरतमंद हैं उन तक यूनानी सिस्टम ऑफ मेडिसिन के फ़ायदे पहुंचने चाहिए। अभी हमने देखा कि पैंडेमिक 19 के दौरान में कितना सारा कोविड-19 के दौरान में कितने सारे मसाइल खड़े हुए और उसमें आपने देखा कि आयुष सिस्टम ऑफ मेडिसिन ने कैसे अपना एक पॉजिटिव रोल और अहम किरदार अदा किया। मुझे लगता है कि जो सिस्टम्स की स्ट्रेंथ्स, जो ज़रूरतें लोगों को हैं और जिन लोगों को हमारे सिस्टम्स के बारे में स्ट्रेंथ्स का अंदाज़ा नहीं है, आई थिंक ये एक बहुत अच्छा प्लेटफॉर्म है। ये चर्चा शुरू होनी चाहिए और ये शुरू हो गई है। तो यूनानी सिस्टम ऑफ मेडिसिन की क्या खूबियाँ हैं, क्या इसकी कैसे हम कंट्रीब्यूट कर सकते हैं मुख्तलिफ डिसऑर्डर्स में, आई थिंक ये अच्छा प्लेटफॉर्म है, इसका भरपूर फ़ायदा हम लोगों को उठाना चाहिए। मैं बहुत ज़्यादा वक्त नहीं लूँगा। इसी के साथ मैं आई वेलकम ऑल द पार्टिसिपेंट्स हु हैव जॉइंड टुडे to listen to our esteemed expert and request them to provide their valuable comments also for the betterment of the Unani system of medicine. Thank you very much for this opportunity. Thank you.
Thank you, sir. Thank you for taking time out of your busy schedule. We are thankful for your vision and guidance in organizing the series of E-Charcha. Now we have amongst us Professor Munawar Hussain Kazmi, Director, National Research Institute of Unani Medicine for Skin Disorders, NRIUMSD, Hyderabad. Professor Kazmi graduated in Unani Medicine from ANU Tibia College in 1984 and was awarded gold medal for standing first in the university examination. He joined CCRUM in 1985 Professor Kazmi, after being promoted as Deputy Director at CCRUM headquarters and subsequently transferred to NRIUMSD Hyderabad in February 2015, the center he is heading since then. Professor Kazmi has significantly contributed in clinical studies conducted by the Council on several health conditions, including vitiligo, psoriasis, sinusitis, hepatitis, and hypertension. He has participated and presented research papers in national and international conferences. At national and international level, he has delivered many keynote addresses and published several papers based on scientific research in national and international journals, and has been one of the authors of monographs on vitiligo and sinusitis, which are based on clinical studies conducted under the aegis of CCRUM and published by the Council. His book entitled Aromatherapy with Rose Oil, Psychopharmacological Studies has been published in 2017 by LAP Publisher Germany. Professor Kazmi started postgraduate teaching and PhD program in the specialities of Molijat and Ilmul Adviya 2016 onwards. Keeping in view his knowledge and experience in the field of preclinical research, quality control, and standardization of Unani drug, Professor Kazmi was given Appreciation Award for his dedication towards research work by CCRUM in 2017. Besides, he has also earned Appreciation Award for services in development of Unani medicine by Ayurvedic Research Hospital, Bose Ayurvedic Hospital, Adalla, Chennai, Sri Lanka. 7th Hakim Ahmad Ashraf Memorial Global Award was also conferred upon him. Based on his enormous contribution in the field of scientific research in Unani medicine, Professor Kazmi is considered a leading researcher and research guide. Today, he is amongst us to proudly present achievements of NRIUMSD as a specialty institute for skin disorders. Before I invite Sir, I will request our viewers to post their comments and queries in the chat box of the social media platforms. We will have a question and answer session after Sir's talk. Please, Sir, you may start with your presentation.
Thank you, Ghazala Madam. With the permission of Chair, first of all, I would like to thank the Government of India, Secretary Sahab, एडिशनल सेक्रेटरी साहब और हमारे डायनामिक डायरेक्टर जनरल प्रोफेसर आसिम साहब, जिनकी काविशों से और जिनके डायनामिक डायरेक्टरशिप में ये एक काम अच्छा गवर्नमेंट ने अच्छा काम शुरू किया है और उसको हमारे डायरेक्टर साहब ने काउंसिल लेवल पर ये ई-चर्चा स्टार्ट की है और हमें इसमें मौका दिया जिससे कि ज़्यादा से ज़्यादा लोगों तक यूनानी के बारे में नॉलेज पहुंच सके, यूनानी के बारे में लोग ज़्यादा से ज़्यादा जान सकें। उसके लिए मैं बहुत बहुत शुक्रगुजार हूँ। मैं शुक्रगुजार हूँ गजाला मैडम का भी और आईटी के तमाम टीम का जो इसमें बहुत ही कोशा है और इसको बहुत ही सक्सेसफुली चला रहे हैं। May I have first slide?
Sir, kindly share your PPT.
Okay.
Yes, sir. It's visible. Please go ahead. Yes, okay, sir.
This is our institute, National Research Institute of Unani Medicine, situated at the Iragadda, a famous place near Amirpet at Hyderabad. So today we are talking on the Unani medicine as a holistic medicine and the achievement of our institute. The Unani medicine is officially recognized by Government of India and different governments, state governments, and it has a distinct identity and capability to manage health problems through holistic approach. The system has great potential in disease prevention and health promotion, as well as dealing with lifestyle diseases related to non-communicable diseases, especially. The strength of the Unani system of medicine is it is a medicatrix and natural. It is to normalize the disturbed humoral balance by diverting the disease matter or evacuating the disease matter to normalize the disturbed temperament, to restore the weakened faculty of the organ and the system. This is nothing but a help to the nature, because as in Unani system of medicine and other system of medicine, nature is the cure giver. So in this way, we see that the Unani system of medicine give strength to strength the nature. हमारे यहाँ ये कहा जाता है कि एक तबीयत है जो हमको तबीयत किसी भी मर्ज से लड़ने के लिए हमारे पास एक फैकल्टी है, और वो अगर कोई डिजीज हमारे अंदर आती है तो उसको ठीक करने के लिए, उसको रिवर्स करने के लिए तबीयत की हम मदद करते हैं. असल जो फिजिशियन है, फिजिक जिसको कहते हैं, तबीयत कहते हैं, वही है, ऐसा यूनानी सिस्टम ऑफ मेडिसिन में माना जाता है. तो अप्रोच टू ट्रीटमेंट इज इंडिविजुअलाइज्ड एंड होलिस्टिक. यूनानी ट्रीटमेंट eradicates root cause of the disease. In Unani, drugs are prescribed according to the temperament. Unani drugs are natural and comparatively safe. Chronic disease like migraine, bronchitis, asthma, sinusitis, musculoskeletal disease, we have a good immunomodulator to treat the allergies and to enhance the immunity or to modulate modulation of the immunity as well as to modify the disease. We have the hepatobiliary disease, very good formulation for the fatty liver disease, chronic liver disease, infective hepatitis, particularly the viral hepatitis, metabolic syndrome, hypertension, obesity, gout, etc. Unani system of medicine also address the psychiatric disease by providing the medicine for depression and palpitation, etc. So skin diseases like vitiligo, psoriasis, eczema, geriatric care like benign prostate hypertrophy, cognitive disorder, and it acts as a adjuvant therapy in tuberculosis, cancer, etc. So as far as this National Research Institute of Unani Medicine is concerned, it was, as Professor Asim Sahab already talked about the detail, that it was started as Central Research Institute of Unani Medicine in December 1971. In this way, we are happy to see that when we are doing this program, this institute have completed 50 years. The institute is having 5.5 acre of land, and its foundation stone was laid in 1983, but we are working here since 1990, and Professor Asim sir already said that it has the NABH accreditation. And this institute has gained worldwide fame for the treatment of vitiligo. Recently, in 2019, the institute was upgraded as an institute and it was named as National Research Institute of Unani Medicine for Skin Disorders, for which we are very thankful to our director and the Government of India. This institute is also imparting postgraduate education into discipline, Unani disciplines, Manja, which is the general medicine, and Ilmul Adviya, that is the pharmacology. The number of seats are now 9 seats in each subject, which means 18 admission per year recently. So as far as the infrastructure is concerned, we have different OPDs, research OPDs and general OPDs, especially the geriatric and RCH OPDs are our separate OPD, and we have 85 bedded IPD. We have in pathology laboratory, developed pathology laboratory with all the latest equipment. We have the microbiology laboratory. Microbiology laboratory not only for clinical, but also we are seeing this. We are using this microbiology laboratory for the standardization of our final product. We have cellular and molecular biology laboratory.
Sir, I think हमने ये infrastructure की information we can see from the slide. Maybe we can move ahead, sir, because we would like to have more interactive talk with you, the level of institute you are heading. So, sir, if we can go to the main activities and achievements.
Right. So, as far as program-wise is concerned, we are having clinical research program, drug standardization, and outreach program like mobile clinical research program, school health program, Swasthya Rakshan and Parikshan, and the post-graduation program. And the preclinical setup, we have the CPCAE recognized animal house, where the preclinical studies can be done, toxicity studies are done there, and efficacy also. Why this is needed? Because I want to convey this to the person, those who are hearing me, that Unani medicine, it is being used for so many years and for centuries together. But as far as its safety and efficacy is concerned, still we need some documentation, because there is no documentation. So we are doing the reverse pharmacology, and the products which we are already using, or if we are changing the dosage form of any product like the जवारिश और त्रिफल उसको कुद्दूस, अगर हम उसकी शक्ल तब्दील करते हैं, जैसे जवारिश से हम उसको किसी पाउडर शक्ल में लाते हैं, कैप्सूल शक्ल में लाते हैं, त्रिफल से हम उसको पाउडर की शक्ल में लाते हैं, किसी भी अगर हम उसकी डोजेज फॉर्म चेंज करते हैं तो वो न्यू मेडिसिन मानी जाती है, और उसके लिए हमको फिर से जो सेफ्टी स्टडीज है, एनिमल के ऊपर सेफ्टी स्टडीज की जाती है. इसके अलावा जो रेगुलर यूज की मेडिसिन है, द मेडिसिन व्हिच आर बीइंग यूज्ड मच and they are very common, so for them also we are testing the on the parameter of safety. One important criteria area for the research is the nephroprotective activity of some Unani formulation, which we are doing here. Okay. Right. Is it now visible? Slide is visible
है, and आपकी स्लाइड आप आगे मूव कर सकते हैं, क्योंकि लिस्ट तो हमने एक नजर देख ही ली है सर. आगे चलते हैं जी, आगे चलते हैं सर इसमें. जी सर.
Standardization of multi-centric. There are so many projects going on clinical fundamental to establish the fundamentals of Unani medicine, then clinical validations of formulation, and we have collaborative study with the IICT, NIPER, and some college, pharmacy college of Hyderabad. So these are some collaborative research. So the institute is most famous for vitiligo studies. So UNIM 001 and UNIM 003 and UNIM 004 and UNIM 005. They are the much effective formulation out of our several formulation. And we have conducted near about this research on 12,211 and 24,187 patients respectively. These are our only the research patient. As far as general patient is concerned, they are more than 1,90,000. So these drugs were evaluated on scientific parameters and found safe and effective in repigmenting the depigmented lesion, in improving the quality of life of the patient, and preclinical and drug standardization studies of these formulations were also undertaken. The preliminary therapeutic evaluation of 4 coded Unani formulations were also studied. They are UNIM 004 and UNIM 054, UNIM 0046, UNIM 0047. These are oral and various for local applications in vitiligo. Other formulations are the PTV 6 and 7. Similarly, we have seen the effect of the Munzig-Musil drugs, and preliminary screening of combination of some 005, 0044, 045, 0 and with Munzig-Musil and without Munzig-Musil. Histological studies of vitiligo evaluated the study of the Unani formulation on various biomarkers and genetics and pharmacokinetic and dynamic. These formulations were also undertaken. And this way, these are the various aspects we have studied. The most important, the histopathological studies in vitiligo. The skin biopsy was done in 24 patients at baseline, and after 3 to 9 months of the treatment with the Unani formulation, they were UNIM 001 and 3 and 004 and 5. So we have seen that before the starting of the treatment, there were no visible melanocytes in the epidermal layer of the biopsy. And after the treatment, when we done the biopsy of the skin, then the melanin granules in the epidermis reappears, and the melanocytes in the basal layer were seen. The Mason staining showed that the presence of the melanocyte pigment and the melanocyte after the treatment only. Before the treatment, it was not seen there after the Fontana Mason stain. So they show that our treatment stimulates the melanocytes, or they are migrated from the normal sites, or if they are inactive, then they become active. Several biochemical studies were also done in, for general information. We see that the vitiligo is nothing but it is the absence of melanin due to the inactiveness of the melanocytes, because melanocytes are the cells which make the melanin, which is the color of the skin. And when there is no melanin, then the skin becomes white. So as far as the etiology is concerned, the exact cause of the vitiligo is not known, but there are several hypothesis. One of them is the genetic hypothesis, in which it has some genetic base, and we have studied that the group which we studied, they have a similar type of genes. Hence, there is a clue that this hypothesis may be right. Then the self-destruction hypothesis is also there, that melanocytes are there, but some chemicals are there, some metabolites are there, and something is there which is either making these cells inactive or it is destroying. So it is local phenomenon, destruction of melanocyte, or it may be an autoimmune hypothesis, but because our immune cells, they are not recognized the melanocyte as a self, but they are recognized as a non-self, and this way this may be due to the autoimmune response. Our own body is destroying the melanocytes. Then there is a neural and composite hypothesis that the nerve ending may be secreting some factors for which are harmful for the melanocytes and which are destroying the melanocytes. The predisposing factor for the vitiligo is topical exposed to certain chemicals which are usually we come into contact with us, or some food incompatibility or gastrointestinal disorder like intestinal bone, and chronic dyspepsia in mental stress plays a greater role. Protozoal infection or prolonged use of antibiotic may cause disturbance in the intestinal flora, which may lead to ultimately some toxins are there, and that may be a contributory factor for the vitiligo. As far as type is concerned, acrofacial, and it is on the mucous membrane as well as on the skin, and generalized or common type, you can see in this is the generalized type. And then universal, when the total body is affected and mixed. Then there is segmental, when it is alongside the a segment of the nerve, and it is one-sided. It may be dermatomal at a part of or confined to one side and at one local part. Then if it is confined to a particular side and particular site, then it is a focal, or mucosal if the mucous membrane is affected. So these are the type. So for diagnosis, we use the Wood's lamps to rule out other causes of the whiteness of the skin. So the lesion actually have the high risk for the sunburn, and the exposed to may lead to cancer very rarely. As far as our institute is concerned, not even a single case has gone to this stage. But we have to expose as a therapeutic, but we also tell to the patient that one should not overexpose to the sun. So the diagnosis is very easy, that clinical diagnosis
सर,
on the basis of
vitiligo के बारे में काफी इंफॉर्मेशन दे दी है. तो अब मैं रिक्वेस्ट करूंगी हम नेक्स्ट टॉपिक पे आ जाएं सर, ताकि हम सारी एक्टिविटीज़ एंड अचीवमेंट्स देख सकें. एंड आई नो विटिलिगो इज़ एन इम्पॉर्टेंट टॉपिक, बट एक आपने जनरल अंडरस्टैंडिंग दे दी है सर.
ठीक है, इसमें विटिलिगो में एक मुंजिज मुसिल
ये बता दीजिए सर,
सब
यूनानी
बात करते हैं.
जो स्ट्रेटजी आपने अडॉप्ट की है, ट्रीटमेंट बता दीजिए सर.
Treatment. Sometimes the patient is already resistant, or sometime after taking medicine, the medicine become resistant. Sometimes the patient is already a difficult patient to treat, because the site of the patch is like mucous membrane or the fingers, they are very difficult to treat. So in this situation, we take the help of biopurification or Tankaya Badan, in which we give the Munzij Musil therapy. And we have seen that after the taking Munzij Musil therapy, the patient responds better than earlier. So these are some important Musil ingredients. Actually, these Munzij Musil ingredients have some compounds which maybe some of them are having flavonoids, some of them are having phenol and polyphenol compounds, which act as a antioxidant and as a purifying agent. So there are some melanogenic single drugs in Unani system of medicine. So these all, this is the list of 23 drugs which are said to be melanogenic and which have been proved to be melanogenic in the treatment of vitiligo. They are effective. So they are melanogenic because some of the compounds, particularly coumarin compounds and tannins present, some flavonoids present in all these different different ingredients. They are responsible for the stimulation of the melanogenesis. So these are some points that when as per Unani classicals, then the challenges of the when there is actually the major challenge is resistant towards the therapy. Sometimes, so how we overcome this challenge? We overcome to this challenge by seeing that what is the factors responsible for that. If we can avoid that, we change the diet of the person, we give Munzij Musil therapy, and then after this Munzij Musil therapy, we are successful. Convert the static phase into healing phase, and then immunomodulatory I have already talked with. These are the detail of the salient feature of the vitiligo. The importance I want to tell in this, that there are certain regions where there is a good response. For example, the scalp, forehead, cheek, neck, arm, forearm, back, thigh, legs. So in this area we have the better response. This is why that our treatment has the better cosmetically acceptable response is good. So overall, as far as overall achievement is concerned, this institute has 348 and more than this good papers in international and conferences and workshops and national conferences. Research papers good research paper which are enlisted in PubMed 99, and then 7 monographs. And some other publications. This is about the response of the therapy. So, we want the rapid repigmentation. Just have on scalp, forehead, cheek, neck, forearm, back of the thigh, leg. This makes the treatment cosmetically acceptable. You can see these photographs of some respondent persons. This is the monograph clinical studies and vitiligo success story. Now coming to the psoriasis, and a quick look on psoriasis is we have a very good response in psoriatic treatment. Unani have the strength for treating the psoriasis. So psoriasis is nothing but over scaling of the disease. You can see this. So as far as type of psoriasis is concerned, this is a plaque psoriasis when it is thicken, the raise and thicken margin of the skin.
सर मैं रिक्वेस्ट करूंगी कि आप ये भी मैनेजमेंट में आ जाइए, मैनेजमेंट पार्ट में ट्रीटमेंट आप कैसे करते हैं वो हमारे व्यूअर्स के लिए इंटरेस्टिंग रहेगा.
So now coming at the treatment part is concerned, because this is a skin deep problem. So here also we have the advantage of Munzij and Musil therapy, because if we do treatment without Munzij and Musil, the effect is not so much as after doing the Munzij Musil therapy. The response of the drug is very good, and even with the Munzij Musil itself, the response is good. You can see some of the photographs of our patient with got response with only Munzij Musil. So the result indicate that 50% of the patient response to treatment was very good within that period, and followed by 26.7% excellent and 13.3% excellent. 50% response, and this 26 and 13% response is in this duration only, duration of treatment, trial. After trial, if we continue the treatment, the longer the treatment, the response is better. The result further indicates that neither the age nor the sex, all the people, male and female, younger age, older age, all responded. The chronic or the with bad symptoms or very advanced symptoms, the treatment is very good. However, it seems that the temperament has some effect of the treatment outcome, as in 85% of the Dammu patient respond to treatment varied between good and excellent, 54%, in comparison to 50% of Sadavi patient only having good response.
सर आप 10-15 मिनट्स में इम्पोर्टेंट अपने पॉइंट्स कवर कर लीजिए, क्योंकि फिर हम डिस्कशंस में जाएंगे. यू मे लाइक टू टेक 10-15 मोस्ट वाइंड अप करने के लिए सर. 3:15 हो गया सर.
So apart from this, we have some research project for our PG students also. That is a part of their curriculum, and we are doing a well RCT in for our PG students also as a part of their. This is our project as well as part of their curriculum. In this, you can see that clinical study to evaluate the efficacy and safety of Habbe Hindi and Habbe Bars in the management of vitiligo. In this way, another one is for acne vulgaris, and then the one is for eczema and the pubartinia corporis and psoriasis. In this way, we are allotting the research on the disease which are related to the skin. So dermatological studies are being done in our postgraduate department also. You can see on tyrosis, eczema, psoriasis, vitiligo, melasma, and dermatophytosis, some so we have research-oriented services in the IPD also, research-oriented healthcare services like mobile school health, Swasthya Rakshan Parikshan, mobile healthcare research programs. And we have the pharmacovigilance program also, because government of India has started that there should be a vigilance adverse effect reporting for the Ayush system of medicine. So our center is doing this for the Unani system of medicine. So we have the survey of medicinal plants. So the objective of is to collect and identification of the genuine medicinal plant for the student as well as for the identification of the correct material. And these are our current activities, research activities in survey of medicinal plant. These are some photographs of the local survey. We have a digital herbarium also. We have a garden in which we have some endemic plants which are very rare endemic plants. We have some vulnerable plants also growing and preserving. So this is the Artemisia absinthium, which is for the treatment of malaria. These are some our former visitors. This is the plantation by our new minister. This is the plantation by Honorable Shri Pathakji. Now coming to the preventive aspect in skin disorders. So certain disorders are not preventable, including the genetic condition and some skin problem due to other illness. However, it is possible to prevent some skin disorders. Following are the tips to prevent. We should wash our hands with soap and water frequently so that we can avoid a large number of infectious skin diseases and allergic skin diseases. Avoid sharing eating utensil and drinking glass with others. This is for preventing not only skin disease but other diseases also. Clean things in public space such as gym equipment before using them. Do not share items like blanket, hairbrush, or swimming suit. Sleep at least 7 hours each night, because the good sleep not only enhance the immunity but it also good for the skin health of the skin. Hydration. Avoid excessive physical or emotional stress. We have seen in vitiligo as well as psoriasis, that when the people are under stress, like during examination of the student or some unhappy event in the family, the vitiligo or the psoriasis problems are aggravated. Eat a nutritional diet, balanced diet is very important for the health of the skin as well as for the response to the treatment and vaccination. We should wash our face gently with clean water. We should use the natural moisturizer. Avoid environmental and dietary allergies. If we are allergic to, if we develop some allergy, we have the incidence of allergy to be in a particular environment, then we should avoid that and avoid the contact with the harsh chemicals. Always we should not we should avoid the contact between skin or any harsh chemical. Thank you very much. Thank you all.
Yeah, thank you so much. Thank you for giving us a comprehensive presentation. आपने डिटेल में हमारे व्यूअर्स को बताया कि स्किन हेल्थ का कैसे ध्यान रख सकते हैं, डिजीजेस को कैसे प्रिवेंट कर सकते हैं। और ये हमारे लिए एक बहुत ऑनर की बात है कि हमारी एक इंस्टीट्यूट जिसने इतना काम किया है स्किन डिसऑर्डर्स पर कि वी आर थैंकफुल टू मिनिस्ट्री ऑफ आयुष एंड गवर्नमेंट ऑफ इंडिया दैट इट वाज अपग्रेडेड टू द नेशनल रिसर्च इंस्टीट्यूट for skin disorders. So thank you to the whole team of NRIUMSD and our under the supervision of our Director General. Much has been achieved, sir, and under your directorship. Thanks a lot. Now we'll straight away go to sir question answer session. स्पेशलिटी इंस्टीट्यूट हमारी ये स्किन डिसऑर्डर्स की है और हमारे पास काफ़ी कॉम्प्लीमेंट्स आए हैं, बधाई आई हैं, लेकिन क्वेश्चंस भी आए हैं कि अगर पेशेंट जो विटिलिगो और सोरियासिस और एक्जिमा के हैं और जो प्रिवेलिंग कंडीशंस में दे आर नॉट स्टेशन्ड एट हैदराबाद and if they want to take consultation or guidance from the doctors and consultants present at NRIUMSD Hyderabad, तो किस तरह से सर अप्रोच करें आपको?
ऐसा है कि medicines, if they are available at their surrounding and if they are not available, we can give some tips so that they can utilize whatever the material is with them. जो उनके पास है, कभी कभी हम ऐसी चीज बता देते हैं उनको, घरेलू इलाज जैसा, या उनको प्रिवेंशन की जैसे बात बताई, और उसमें विटिलिगो में भी हम कुछ डाइट मॉडिफिकेशन ऐसा बता देते हैं कि आप ये करो, या फिर हम जो अवेलेबल उनके पास है, उनके घर में जो चीज अवेलेबल, व्हाटएवर इज अवेलेबल विद देम, हम उसमें से कुछ करने के लिए उनको बताते हैं। फॉर एग्जांपल, अगर विटिलिगो का कोई पेशेंट है तो हम ये देखते हैं कि उसकी डाइट में कुछ मॉडिफिकेशन ऐसा करें जो अच्छी डाइट मिले, न्यूट्रिशनल डाइट मिले, और पूरा डिटेल हिस्ट्री लेके रीजन क्या है। बहुत से बार तो ये रीजन होता है कि उनको अनीमिया होता है, तो क्या वो ठीक कर सकते हैं, तो उनकी रिपोर्ट अगर है एट प्रेजेंट तो हम पूछ सकते हैं कि आपके पास कुछ आपने इन्वेस्टिगेशन कराया है, कि किसी डॉक्टर के पास गए हो, तो वो हमको टेलीफोन पे या वो बता सकते हैं, देख सकते हैं। और कभी कभी जैसे कॉन्टैक्ट विटिलिगो, अभी असल में विटिलिगो के बारे में डिटेल में बहुत बड़ा सब्जेक्ट है ये असल में, और बहुत सारे इसमें मल्टीफैक्टोरियल है, बहुत सारी चीजें हैं, तो वो हम देखते हैं कि क्या उसको कोई दूसरी ऑटो इम्यून प्रॉब्लम तो नहीं है। उसके लिए हम, जैसे मैंने बायो प्यूरिफिकेशन की बात की, तो उसमें उसका टेम्परामेंट कैसा है, उसके टेम्परामेंट के हिसाब से जो लिस्ट थी वो बायो प्यूरिफिकेंट की, उसमें से 2-3 ऐसे जो उसको आसानी से मिल सकते हो वो हम इस्तेमाल करने के लिए कह देते हैं। एक्सटर्नल एप्लीकेशन के लिए अगर उसके पास कुछ ऐसी चीजें, तो जो कॉमरिन कंटेनिंग कंपाउंड्स लोग जैसे केसियाटोरा वगैरह, तो उसके लिए एक्सटर्नल एप्लीकेशन, जी, तो वो हम उसकी हेल्प
काफी है सर, जैसे
दूर से भी। जी
जी सर, जैसे आप बता रहे हैं कि काफ़ी वास्ट इंफॉर्मेशन है जो अभी आप शेयर नहीं कर पाए यकीनन, लेकिन आपने एक झलक दिखाई थी मोनोग्राफ की भी कि पब्लिकेशन है। तो अगर हमारे व्यूअर्स दे वांट टू हैव कंप्लीट अंडरस्टैंडिंग एंड दे वांट टू नो व्हाट ऑल टू डू एंड व्हाट नॉट टू डू, तो ये अवेलेबल हो जाएंगी क्या? कुछ हैंडी टिप्स, कुछ बुकलेट्स, कुछ हैंडबुक्स आपने निकाली हैं? और सर दूसरा क्वेश्चन हमारे पास ये आया है, 2 क्वेश्चन मैं आपसे एक साथ पूछ रही हूँ, तो पब्लिकेशन और दूसरा जो आपने इंग्रेडिएंट्स एक नज़र दिखाई तो थे, लेकिन आपकी कोडेड फॉर्मुलेशंस हैं। इसमें ये
जी
जानना चाह रहे हैं कि किस तरह के इंग्रेडिएंट्स यूज़ गए? ऑफ कोर्स ये कोडेड हैं तो आप पूरी फॉर्मुलेशन तो नहीं बता सकते, लेकिन जस्ट टू गिव अ
जी
जनरल आइडिया जितना आप पब्लिक को दे सकते हैं, क्या मेन होती हैं दवाएँ जो हम यूज़ करते हैं इसमें?
इसमें हम लोग जो यूज करते हैं वो ऐसी प्लांट्स हैं जो जिनमें कमरिन कंपाउंड्स और टेनिन्स बहुत ज्यादा है, इसलिए मैंने लिस्ट भी उसकी मेलानोजेनिक की लिस्ट भी दिखाई थी
जी सर।
कि वो उसमें से हम जो उसके टेम्परामेंट के हिसाब से चूज कर सकते हैं। ये जो है हमारे ट्रायल्स में जो कुछ बेस्ट आए हैं उनके हमने कॉम्बिनेशंस बनाया, उनके कॉम्बिनेशन पे हम और ट्रायल्स कर करके हम उसमें ये करते रहते हैं, फार्मूले को हम ऑप्टिमाइज करते रहते हैं।
और आपने जैसे बताया पब्लिकेशंस भी अवेलेबल है जो ले सकते हैं व्यूअर्स और उसमें डिटेल्स पढ़
जी जी
सकते हैं।
जी वो है। और ये जो मोनोग्राफ है ये ऑनलाइन भी है, डाउनलोड हो जाता है अगर सीसीआरयूएम के उससे। हालांकि हमने उस पे अपनी वेबसाइट पे नहीं दिया, लेकिन से गूगल ने उसको बहुत ज्यादा पॉपुलर होने की वजह से वो अवेलेबल है,
सर
ले सकते हैं। और उसमें असल में ये उसमें प्रॉब्लम ये है कि उसमें जो फिजिशियन बीच में जब तक ना हो तो ऐसा ना हो कि वो सेल्फ मेडिकेशन से स्किन तो बहुत डेलिकेट होती है, बहुत
यकीनन सर, ये हम अपने
है।
व्यूअर्स को बताएंगे। आपने बहुत सही बात कही है कि जब स्किन डिसऑर्डर्स पे वो कंसल्टेशन के थ्रू ही करें। आपने जो इंग्रेडिएंट्स भी बताए हैं दैट शुड बी टेकन
जी
अंडर द सुपरविजन ऑफ अ रजिस्टर्ड यूनानी प्रैक्टिशनर्स, उन्हीं के कंसल्टेशन में लिया जाए। और जैसे कि आपने बताया इसमें स्ट्रेस मैनेजमेंट इंपॉर्टेंट है, डाइट इंटरवेंशंस इंपॉर्टेंट है। सर एक क्वेश्चन हमारे पास आया कि आपने बताया था, क्योंकि कुछ हमारे साथ स्टूडेंट्स भी जुड़े हुए हैं और फैकल्टी भी है कई कॉलेजेस की, कि इब्ने बेतार हर्बल गार्डन आपके पास है। सो इफ इन नियर फ्यूचर excursional tour is planned for the students or faculty, तो what would be
जी
the modalities, वो कैसे करें ताकि आपका ये जो इतना बेहतरीन
जी
हर्बल गार्डन आपने हमें पिक्चर दिखाई
जी।
वो या तो वर्चुअल
उसमें
मोड
कुछ
पे
ऐसे
करंट
प्लांट्स
कंडीशन।
भी है जी जी,
जी
रेयर एंड एंडेंजर प्लांट भी उसमें है। तो हमारे पास स्टूडेंट आते रहते हैं, आपने देखा उन्हें फॉरेन टीम्स भी आई थी, श्रीलंका से भी आए थे
अब
आयुर्वेदिक
सर ये
कॉलेज के।
पूछ रहे हैं
और
कि
हमारे
अब अगर
पास
इनको
जी
अरेंज करना है तो व्हाट वुड बी द
जी
मोडालिटी, कैसे अरेंज करेंगे? ये
तो
फैकल्टी का
हमको
क्वेश्चन
डेट
आया। हम्म,
जी जी जी। तो वो हमको डेट बता दे किस डेट में आ रहा है, किस टाइम पे आ रहे हैं, तो हमारे बॉटनिस्ट स्पेयर रहेंगे और उनको बताएंगे, समझाएंगे, प्लांट्स दिखाएंगे कि कौन से प्लांट्स उनको दिखाने हैं। पहले से वो प्लान बना के रखेंगे जिस टाइप के वो स्टूडेंट होंगे, अगर वो बॉटनी के स्टूडेंट्स हैं
एक
या
रिक्वेस्ट लेटर
आयुर्वेदिक
सर
के
आपको भेज दें
स्टूडेंट।
और फिर
जी
कंपिटेंट अथॉरिटी से अप्रूवल
हाँ हाँ,
लेंगे और
जो
वो हो
अपने
जाएगा सर।
जी जी जी, हमारे स्टूडेंट्स भी, चूंकि हम लोग अपने स्टूडेंट्स को भी डिमॉन्स्ट्रेट करते रहते हैं, तो उन लोगों को भी जी कर देंगे और करते रहते हैं। हम आए दिन कोई ना कोई कॉलेज के लोग आते रहते हैं, महाराष्ट्र से भी लोग आते हैं, जैसे से कुछ केरला से भी, कुछ कभी बॉटनी के स्टूडेंट्स आते हैं, आयुर्वेदिक के स्टूडेंट्स आते हैं, यूनानी के भी स्टूडेंट्स आते हैं। और अभी
सर
एनएमपीबी से
आपने
कुछ
बहुत
लोगों
सारी
को
जानकारी दी
चांस
स्किन
भी दे रहे हैं।
डिसऑर्डर्स के लिए सर। आपने
जी
हमें
जी
बहुत कुछ बताया, विटिलिगो को कवर किया, सोरियासिस को आपने कवर किया है सर। तो अगर आप
जी
हमारे व्यूअर्स को एक टेक अवे मैसेज देना चाहेंगे, आपने लास्ट की स्लाइड्स में बताई तो थी, अगर आप उसको सम अप करना चाहें, हाउ टू टेक केयर ऑफ द स्किन एंड हाउ टू प्रिवेंट द स्किन डिसऑर्डर्स, तो आप उसको कैसे सम अप
जी
करेंगे, क्योंकि आपका इतना वास्ट एक्सपीरियंस है सर इस फील्ड में।
जी जी। देखिए स्किन की अगर हम स्किन की पूरी डिजीजेस को देखें, कुछ इन्फेक्टिव डिजीजेस हैं कुछ जो है वो नॉन इन्फेक्टिव डिजीजेस है, जैसे विटिलिगो, सोरियासिस, ये नॉन इन्फेक्टिव डिजीजेस है। लेकिन इसमें भी क्या होता है कि ओवरलैप, जैसे सोरियासिस है, अगर उसने खुजा लिया वो तो इन्फेक्टिव, तो ये बाज तो जैसा विटिलिगो है उसमें अगर उसको मेडिसिन लगाए और उसमें कुछ स्क्रैच आ गया तो इन्फेक्टिव डिजीज फिर होने के चांसेस है। तो ये ओवरलैप एक दूसरे को करते हैं, इसलिए हमको जब भी स्किन डिजीज की बात करते हैं तो एज ए होलिस्टिक ही हमको करना पड़ेगा। और हमारे फॉर्मुलेशंस भी ऐसे जो होलिस्टिक है, उसमें कुछ इन्फेक्शन को प्रिवेंट करने के लिए भी, और लेकिन स्किन के लिए सबसे इम्पोर्टेंट चीज ये है कि स्किन पे हम वही चीज लगाएंगे जो नेचुरल हो। नेचुरल चीज के अलावा आर्टिफिशियल जो भी कुछ है, कॉस्मेटिक्स में आजकल बहुत ज्यादा आर्टिफिशियल भी चीजें आ रही है, उनसे हमें बचना चाहिए। कॉस्मेटिक्स में भी हम कॉस्मेटिक्यूटिकल एक बहुत बड़ी रेंज है जिसमें हम हर चीज जो है वो प्लांट्स ओरिजिन की दे सकते हैं। मिसाल के तौर पर जैसे सिंदूर है, आपने बहुत अच्छा सवाल किया, तो उसमें क्या होता है कि जो हम लेड है वो नुकसानदेह है, और कभी कभी जो बिंदी है वहाँ पे विटिलिगो हम हो जाता है, क्योंकि जो वो ग्लू है आर्टिफिशियल, वो ग्लू आर्टिफिशियल होता है, उसमें केमिकल होते हैं, हालांकि सेफ्टी फिर भी है लेकिन हो जाए। तो उसके लिए हमारे पास जो जैसा कमेला है, तो सिंदूर के लिए कमेला यूज कर सकते हैं, बिंदी के लिए कमेला, हल्दी का यूज कर सकते हो। इसलिए हमारे पास बहुत अच्छा नेचुरल रेंज है, यही यूज करें, और केमिकल्स को ज्यादा से ज्यादा हमारे खाने में भी अवॉइड करें और ऊपर स्किन के कॉस्मेटिक्स में भी अवॉइड करें, ये इम्पोर्टेंट है। और एक चीज इम्पोर्टेंट है कि बहुत सारी चीजें ऐसी उससे होती है स्किन डिजीज जो हमारे कांटेक्ट में आता है। जैसे हम बेड पर सोते हैं तो बेड हम चादर बदलते रहते हैं, नीचे जो वो जो गद्दा होता है उसको हम चेंज नहीं करने से बहुत सारे एलर्जेंट कभी कभी ऐसे हो जाते हैं कि जो हमें स्किन एलर्जी देते हैं। तकिया हम ऊपर का गिलाफ या कवर बदलते रहते हैं, तो तकिए को हम धूप में नहीं डालते। तो जो हमारे कांटेक्ट में चीज आती है उसको अगर किसी चीज को हम बहुत पुरानी हो गई तो चेंज करें, नहीं तो जब तक यूज करना है, यूजेबल है वो, उसको हम यूवी लाइट तो नहीं दे सकते, लेकिन दूसरा तरीका ये है कि हम ओपन सन में उसको रखें और फिर हम यूज करें। जो साबुन है वो बहुत ज्यादा जो साबुन आ रहे हैं उसमें खुशबूदार बनाने के लिए, अट्रैक्टिव बनाने के लिए उसमें आर्टिफिशियल फ्लेवर, वो आर्टिफिशियल
जी सर, आप कहना ये चाह रहे हैं कि नेचुरल उसमें भी रहे। हाँ जी सर, ये बहुत एक इम्पोर्टेंट पॉइंट आपने रेज किया है सर, या और हमारे व्यूअर्स ने इनको सुना है। एंड आई कैन सी आवर रेस्पेक्टेड डायरेक्टर जनरल सर इज आल्सो हियर। तो सर हमें कॉम्प्लीमेंट्स मिल रहे हैं टू नो देयर पीपल आर हैप्पी दैट वी हैव वन नेशनल रिसर्च इंस्टीट्यूट specialized for skin disorders. So sir, under your leadership in near future sir, are we looking forward for more such specialities institutes under CCRUM? And with this present institute, are we planning to enter into more collaborations to take it forward, sir?
That's true. I think जो हमारा ये नेशनल इंस्टीट्यूशन है हैदराबाद का, this is a wonderful upliftment in terms of Unani system of medicine. 2 days before, when I was speaking on this platform, through this platform, I had informed that government of Haryana, and we are thankful to them that they have allotted us to CCRUM one piece of land around 8 acres, and that is with the name of registered name of CCRUM now. Registry has been done, and the plan for that is to develop a national institute of Unani medicine in lifestyle disorders, and that is almost 120 bedded hospital also attached to that is also coming up. So there are always possibilities for further expansion and growth in this direction. We are also thinking that other institutions which we have one other than this national institute, we have central institution in Lucknow, and we have almost 8 to 10 regional institutions in India. So many new centers are also coming up. So always there is a possibility and a scope, and we are trying to enhance the facilities in those centers. So yes, that is a possibility. And as I told you, immediately one center has been declared for that we will be developing that soon as National Institute for Unani Medicine and Lifestyle Disorders in Faridabad. So this is there. As I also told that we have been allotted and now the buildings are almost ready for one regional institution in Mumbai, in Navi Mumbai, one state-of-the-art developed facility is with us. I think March we are going to have the building with us. We already have one regional center in Mumbai. Right now we are housed in JJ Hospital campus. But we are going to have a separate building in Navi Mumbai to shift to. Similarly, we are also having one more new campus in Assam. There is one place, Silchar. So that building is almost complete. Hopefully by June this year, we are going to have that building and we will be shifting that building and converting that as a regional research institute of Unani medicine. So many such initiatives are already being taken care of, and hopefully in the future we would be further exploring the possibilities of expansion.
Great to know, sir. हमारे पास एक क्वेरी आई है या रिक्वेस्ट आई है श्याम सिंह जी की. ये कह रहे हैं कि मस्कुलर डिस्ट्रॉफी पे इनको दिखाना है काम, तो किधर ये जाएं या क्या हमने वी हैव टेकन अप सम वर्क ऑन दिस एरिया मस्कुलर डिस्ट्रॉफी. एंड सर जो दूसरा कंसर्न मैंने मुनव्वर साहब से भी पूछा था, जो दिल्ली बेस्ड हमारे पेशेंट्स हैं विटिलिगो के, तो आई थिंक सर आपकी जो दूसरी रीजनल रिसर्च इंस्टीट्यूट्स हैं उसमें हम स्पेशलिटी ओपीडीज तो करते हैं. मीनवाइल जब तक वो हैदराबाद नहीं जा सकते कोविड-19 लाइक सिचुएशन में, तो दिल्ली में सर दे कैन गो एंड टेक द कंसल्टेशन फॉर दी स्किन डिसऑर्डर्स.
I think this is a good question, Dr. Ghazala, and we need to inform people that though our premier institution in terms of vitiligo or psoriasis or other skin disorders is in Hyderabad, but these days all our specialists like Dr. Munawwar Sahib and other his colleagues in Hyderabad, we all are available online as well in facility. So the gentleman or some person who is living in Delhi area, they can go to our regional research institution of Unani medicine in New Delhi, that is in Okhla, and one more center we have, that is the Hakim Ajmal Khan Literary Research Institution. There also we conduct the OPD. So we have specialists there sitting. So in consultation with other colleagues, they also are equally capable, and the regimen is available with those doctors also, whatever the regimen we have developed in Hyderabad campus. So the regimen every one of our colleagues know, and if still there is any other need for any further consultation or other opinions, so other colleagues, our colleagues from Hyderabad are already available online. So I think this way we could assist the people in their skin disorders to manage their skin disorders, whether they are vitiligo or they are psoriasis or any other skin disorders like seborrheic dermatitis or whatsoever. So I think this mode they can come and they can show and they can start the treatment, because all the doctors which we have in our units, they are well qualified and expert doctors. And one more thing is there, that in our institution there is one, I would suggest is a facility that many doctors who are, yesterday they were in Hyderabad, sometimes they come for their expertise and try to groom the centers in different institutions in the country. So many they will find who have already come from Hyderabad, or some are shifting from here to Hyderabad or some other institutions. So this interchangeability is there. So I think the joint expertise, that's why we are developing. So with this facility understanding, we can help them out, definitely, in Delhi as well.
यकीनन सर, विटिलिगो एक ऐसा डिजीज़ है जो हम डिस्कस कर रहे थे कल भी. स्ट्रेस काफ़ी हो जाता है पेशेंट को, स्पेशली अगर फीमेल पेशेंट इन्वॉल्व होती है. सो दिस इज़ गिविंग क्वाइट होप्स टू सच पेशेंट्स सर, एंड वी आर रियली हैप्पी टू नो. और जैसे पब्लिकेशन का आया था, तो सर हमारे मोनोग्राफ हैं, आईसी बुकलेट्स हैं जो हम इशू करते रहते हैं टाइम टू टाइम, दैट इज़ फॉर जनरल इन्फॉर्मेशन. लेकिन जैसे हमने इसको क्लियर किया कि ये जो मेडिसिन है या ट्रीटमेंट है अंडर रजिस्टर्ड यूनानी फिजिशियन ही ये लोग लें. अदरवाइज सर हमने अभी रिसेंटली यूनानी मीडिया में देखा आपने कॉमन होम रेमेडीज़ की बुक भी रिलीज़ कराई है, अगर उसके बारे में भी आप बताना चाहें हमारे व्यूअर्स को सर.
देखिए, अभी हमारा जैसे आप सब लोगों को मालूम होगा कि 11 फरवरी एक यूनानी डे डिक्लेयर्ड है बाय मिनिस्ट्री ऑफ आयुष गवर्नमेंट ऑफ इंडिया, और ये जो दिन मुंतखब हुआ था वो इसलिए कि हकीम अब्दुल अजमल खान साहब की बर्थडे है इस दिन, और सब लोग इसको ऑब्जर्व करते हैं इस दिन यूनानी डे को। तो हमने 11 फरवरी को विज्ञान भवन में अभी एक फंक्शन किया था जिसके अंदर हमने वी ऑब्जर्व दिस यूनानी डे। हमारे बाकी साथी मुख्तलिफ मुल्क के मुख्तलिफ कोनों से आए थे और सबने शिरकत की और बहुत सारे लोग वहाँ पर आए थे। एंड वी टुक गुड केयर ऑफ कि हमने कोविड-19 का ख्याल रखते हुए जितना हम कर सकते थे हमने करने की कोशिश की। तो उसमें वज़ीर मोहतरम भी आए थे और बाकी मिनिस्ट्री के तमाम हमारे ऑफिशियल्स भी थे, सेक्रेटरी साहब थे और एडिशनल सेक्रेटरी साहब थे और दूसरे तमाम जिम्मेदारान थे, जॉइंट सेक्रेटरी थे। सो उस वक्त में हमने कुछ किताबों को रिलीज़ किया था, कुछ किताबें जो CCRUM ने बाकी तमाम कैंपसेस के सपोर्ट के साथ डेवलप की थी। उन किताबों को हमने उस रोज़ रिलीज़ किया था जिनमें कई बड़ी अहम किताबें थी। उनमें से एक किताब है जो कॉमन रेमेडीज़ की किताब है। ये कॉमन रेमेडीज़ की किताब पहले भी CCRUM बना चुका है और मंजर आम पर आ चुकी है और बहुत सारे लोगों ने उसको फ़ायदा उठाया था, लेकिन उसमें तकरीबन 20 साल पहले की शायद वो बात है, 20-25 साल हो गए थे, उसको शायद ज़्यादा ही हो गए थे, तो उसका एक रिवाइज वर्जन लाने की ज़रूरत थी। तो हमने वो कॉमन रेमेडीज़ की किताब है और उसके अंदर बहुत सारे नुस्खे ऐसे हैं जो आम लोग उसको देख के बहुत सारी चीज़ों को इस्तेमाल कर सकते हैं, जिसके अंदर ऐसी चीज़ें जो घरों में आमतौर से इस्तेमाल होती हैं उनके कॉम्बिनेशंस हैं, उनके रेजिमेंट्स भी हैं। तो आई थिंक वो आम लोग उसको ज़रूर ले सकते हैं, उससे फ़ायदा उठा सकते हैं। जो उसमें ऐसी दवाएं हैं, ऐसे रेजिमेंट्स हैं जिनके लिए थोड़ी एक्सपर्ट ओपिनियन की ज़रूरत पड़ेगी, तो उसमें हमने मेंशन भी किया है कि उसके लिए यूनानी फिजिशियन के साथ अगर वो ताल्लुक़ पैदा कर लें और यूनानी फिजिशियन के साथ एक्सपर्ट ओपिनियन ले लें तो वो ज़्यादा बेहतर होगा, सो दैट उनको सिर्फ फ़ायदा ही पहुँचे उससे।
जी सर। So, sir, thank you so much. And I think now we will conclude the session. And I will once again thank you, sir, Professor Asim Ali Khan Sahab, for gracing the occasion as the guest of honor and joining us for question and answer session also. Thankful to Professor M.A. Kazmi for a very informative talk. And I'll again like to thank the various position holders and authorities and policy makers, respected Secretary Sir, Vadya Rajesh Kotecha ji, Shri Pramod Kumar Pathak Sahib, Additional Secretary, Shri P.N. Ranjit Kumar Sahib, Joint Secretary, Ministry of Ayush, for providing us this opportunity and carrying out E-Charcha on Unani medicine on AVCC platform. Thankful again to IT and social media team of Ministry and CCRUM. We will be meeting again tomorrow, 19th February, for the next lecture series at the same time, that is 2:30 p.m. sharp. We are also here on 22nd of February. Join us. Thank you so much. Thanks a lot, sir.
Thank you very much. Take care.